trafficking victims have a life expectancy of about 7 years. What we see with victims a lot is, in particular domestic violence, is it takes them a while till they decide to leave their perpetrator. And during that time, they're kind of weighing their options. So what we actually get a lot of is people just calling our hotline and processing through that. This is the situation I'm in. What are my options?
Welcome to another episode of Keeping It Real, where we have real conversations with real people. And today I had the pleasure of speaking with Mary Quinn, who is the CEO of the YWCA and serves the Greater Harrisburg area. But first, I want to give a special shout out to Pine Hill Company. They are builders that are currently servicing the Lebanon and Lancaster County areas. And we had the pleasure of shooting this episode in this multi-million-dollar home on Fleetwood Drive. It is simply amazing. I cannot wait to share additional tour with you after this episode. Welcome, Mary.
Thank you. Thanks for having me.
You're so welcome. Thank you for coming all the way to Lititz, Pennsylvania. Girl, I know this was a hike. Yes, because you're up on the hill. Yes, off of Market Street. So thank you so much for your time. I really appreciate it.
You're welcome.
Yes. So tell me a little bit about yourself and then actually how you got into your role as a CEO and then also the YWCA, if you could, please.
Yeah, so I came to the YWCA about 12 years ago now, and I was a lobbyist I did government relations for about 13 years for a statewide organization, and they were wonderful. I loved my coworkers, my boss, but it was a really boring job.
A lobbyist was a boring job?
It was.
Oh my gosh.
I did really boring government relations stuff. So it really wasn't, wasn't very interesting. And it's a lot of kind of less like lobbying on the Hill, more lobbying with state agencies about different rules and regulations and stuff like that. So, and once you do something for a very long period of time, it kind of gets a little stale.
Yeah.
But, I wanted to find the right role. And I had read a book called Half the Sky. And it's really about empowering women all around the world who don't have equal opportunity and equal access to whether it is jobs, education, healthcare. And a lot of these countries are holding themselves back because they're not investing in the other 50% of their population.
Mm-hmm.
So it was a really impactful book that I read. And I was, really looking for another job and what would bring meaning and purpose into my life. And there happened to be an opening with the YWCA. And I really aligned with their mission and the work that they did to empower women. And so I applied and I got it. And I was their chief operating officer for almost 2 years. And then the CEO position came available. So
that's awesome.
So yeah, that's how I came to be at the YWCA. And over a decade later, here we are doing wonderful things and growing the organization and even the areas in which we serve.
Right. So I'm just curious because I don't know. Was the previous CEO, were they a male or a woman?
It was a woman.
It was a woman. Okay. Yep. I was just curious to know if it was just something new thing that happened, but okay. Alrighty. So it was you were preceding another woman.
Yes. Yep.
Okay.
And a woman of color at that.
Oh,
and
really?
I am still good friends with her. Yeah.
Oh, wow.
Tina Nixon, and she hired me. And, I always say, I think the reason one of our kind of clicking moments was, she asked me why I wanted to work for the YWCA. And I said, hey, I read this book. It really resonated with me and I loved it. And YWCAs are a worldwide organization.
Mm-hmm.
And she was going to the Worldwide Council meeting. And they had sent that exact same book to her and said, this book is so relevant to the work that we do. You should read it before you come to the World Council. So, we had a little coming together over this book and kind of the meaning and purpose behind that book and how it related to the YWCA. So I always attribute that book for her and I becoming friends and colleagues. And yeah, still to this day, we get together a few times a year and
so you remained friends. That's really good.
Yeah.
That's awesome to know. Yeah, because then you can actually back things off of her and say, hey, you know what? I'm having this situation. how would you deal with this? So that's great that I'm a mentor and a friend.
Yep. And she still, and her new role has some ability to support us like financially through foundation funds. So, she allocates money our way, and we collaborate on different kind of conversations on, women's empowerment and racial equity and things like that, because she's in charge of DEI for UPMC.
Oh, that's great.
Yeah. So we still like collaborate, and she kind of brings some of the stuff that we built at the YWCA around those issues to her new role, and we support her in that as much as we can.
Yeah. And I believe, at least for our area, I noticed that you hear a lot about the YMCA, right? Because of like the camps that they have, or the recreational, or you can go to the gym to work out, and, things that's more community based. But there's a lot of things that the YWCA is doing for our community, and I wanted to shine a light on it. And that's why I wanted to have you here today. Could you explain like some of the things that the organization is doing?
Yeah. Yeah. So often YWs live in the shadow of the YM.
Yeah.
And my thought for that is because YWCAs, we do very different things, and we're kind of doing the darker side of the work, right?
Yes,
so we're doing the things that people don't want to talk about, whether it is a domestic violence, a sexual assault, or human trafficking, homelessness, even visitation services for individuals who have lost custody of their children. We do a court-ordered visitation. All these things are not like warm and fuzzy, where the YM typically focuses on, health and fitness and those summer camps. So when YWCAs and YMCAs were kind of first established in London, England, it was really built on this idea of mind, body, and spirit. So with the YMCA, you'll still see the triangle, the mind, body, and spirit. And they both, kind of dropped that faith-based component that they originally had. But YMs went into the direction of the body, and while YWs went in the direction of the mind, and women educating each other on the rules and the laws that impacted them that they weren't allowed to vote on or have any say on. And so that's how kind of YWs evolved into advocating for women, advocating for women's rights, advocating for women to have safe childcare, advocating for women to, not be abused and that sort of thing. So every YW is a little different. We're one of the larger YWs in the state of Pennsylvania. So we're doing all of those services that include, preschool, visitation, civil legal representation, housing and homelessness, both on-site and in the community. We have a veteran specialty that we work with. Homeless veterans, we help find them employment. We do employment programs for other individuals in the community. And then, of course, all of our domestic violence, sexual assault, and human trafficking work as well. So, we're serving over 10,000 individuals with direct service. We're running 24 hours a day. We have 100 staff. And our location is, as you know, is pretty large.
Yeah.
Provide all those services out of as well.
Yeah, it is very large. So let's talk about, someone's in a situation where they are being abused. A lot of times we don't know where to turn. How can the YWCA help that person in that capacity? Do they have to be considered to be homeless? Do they have to be below like a certain income level? Do they, you know what I mean?
Yeah.
A lot of people don't know. So they don't know the ability that they have and the support system that they have through the YWCA.
Yeah. If you're a victim, no, there's no eligibility. It doesn't matter if you're, how you identify, what your orientation is, male, female. Doesn't matter what your income level is. You're a victim, you need service, especially if you're in a crisis situation, and we're going to serve you regardless. And some people, what we see with victims a lot is, in particular domestic violence, is it takes them a while till they decide to leave their perpetrator. And during that time, they're kind of weighing their options. So what we actually get a lot of is people just calling our hotline and processing through that. This is the situation I'm in. What are my options? Okay. Or, we do safety planning. If you know your perpetrator is escalating, don't stand in the kitchen by the knives.
Right.
Right. So we're doing those type of safety plans, but every single county in the state of Pennsylvania has a victim services organization. It's not necessarily a YW, but there is one. And you can call your county victim services, and they're going to be able to provide all of the things in terms of, safety planning and helping you find a safe location. And if you choose, if you're in Lancaster County, for instance, and you present at a hospital because you've been abused, that hospital is going to have a contract with their local service provider here in Lancaster. And you can tell that individual, you can tell that advocate that comes from the Lancaster advocacy program, I don't feel safe in Lancaster County. I want to relocate to Harrisburg. They would call us and we would put you in our shelter, essentially.
That's great information right there. Because a lot of people feel as though, especially when you're in those desperate situations, that you're stuck. And I have to, stay where I am. And my perpetrator is going to know where I am, regardless of whether or not I have services, wherever I have services, if I'm local.
Yeah.
So to know that you actually have the opportunity to go to your location that's actually probably gratifying to some people now listening.
Yeah, and vice versa.
Yeah.
Like if you present yourself at Hershey Med Center, we would be the ones to show up. And if you said, I don't want to be in Dauphin County anymore, you could tell us where, and we would call that shelter, and we would try to arrange for you, try to arrange transportation and to have a space available, whatever community it was that you wanted to relocate to.
Right.
And we're going to work with you. A lot of people don't leave. Number one reason, a lot is going to be children. And we take children in our shelter. So, we're going to work with the individual and figuring out what those next steps are with the childcare, but also pets. Pets are very vulnerable in situations of violence. And a lot of times, unfortunately, pets are used as a threat. They injure the dog to say, that's going to be you next time.
No, Mary.
And so we also have relationships built with the Humane Society that they would temporarily house your pet while we figure out next steps. So you wouldn't lose that, and it wouldn't prevent you from leaving a dangerous situation.
Right. Man, so you talk about, domestic violence, but then we also have another aspect that seems to be now coming to the forefront of people being aware, and that's sex trafficking. So in central Pennsylvania, a lot of people think that that's not even a thing. It's not even something that we have to be worried about. Can you share with us the experiences that we're seeing at the YWCA and how we need to be more aware and how we actually can help?
Yeah. So the YWCA has the only federal grant in the state of Pennsylvania for human trafficking. Most people don't realize that.
Really?
Yeah. There's a lot of people doing, trafficking work, but we're the only ones that are federally funded to do so. And, we were heavily reliant on our background of sexual assault and domestic violence because there are some layers that associate with that. And a lot of times what we see is a victim will present themselves, if they're not brought to us by the police or a hospital, then they might present themselves as a domestic violence victim. And so, we start to kind of triage them, build that relationship with them. And maybe a few days later, we find out, through some questions and relationship building that what was really going, but they often believe that the person who victimized them loved them and just lost their temper.
Yeah, manipulation.
Yeah. And what we find out is they were asked to do sex acts in payment of food or housing or, all of these things. It was a very coercive behavior. So when we start, I think that's why people don't think that human trafficking is an issue in either they think of it as a third world country kind of thing. And they think of it in this sensationalized, the movie Taken with Liam Neeson. It's like where people are, this young woman is just plucked off the street. And that's not at all. I mean, it could happen. Rarely does it. But most often the people that are trafficked are the people who are at risk, who come from situations where they won't be missed. And they have drug addiction or mental health, and perpetrators are really great at kind of pinpointing those individuals, grooming them, and making them feel like they're special or they've been cared about.
Right.
And now you have to do these things.
So then they're just around anywhere, let's just say at a grocery store, and they're just looking for someone, and they'll take them in by asking them certain questions, and they're like, wow, someone's showing me attention.
Right.
And then they end up, I don't know, exchanging numbers or meeting somewhere, and that's how the relationship builds, is what I'm hearing you say.
Yeah.
It could just be some random place. So they have an eye for this.
Yeah.
The perpetrator has an eye for it.
And we have seen, especially with trafficking victims that are very young, they put their whole lives out on social media. Like we've had some runaways. So who, it's like, I hate my home life situation, so I'm leaving. And they put, they kind of document their lives and whereabouts on Facebook. And we've certainly had people reach out to them, perpetrators reach out to them and say, you're too pretty to be treated like that. I would treat you better. Why don't you come with me?
Sending DMs.
Yeah. Or they are living on the street, and somebody approaches them and is like, well, I can take care of you. I can keep you safe. And sometimes it does seem like a better option. We have had plenty of victims who come in and then they're sick. They have a bed, they have food and shelter, all the things that they need, and they go back to their perpetrator.
Why, Mary?
And it's such a trauma bond is what it is. A lot of times, it's also addiction fueled. Like, okay, now I'm still addicted to the drugs that I was on that this person gave me and kept feeding me. And, it's too hard to get clean. And then I have to face the reality of everything that's happened to me. So yeah, they go back, and that trauma bonding is really something that it's hard to kind of fathom and understand.
Yeah, it's sad, but the first thing I thought of was like the biggest, I think, sex trafficking situation was R. Kelly, if you think about it.
Yeah, right.
And the stories that were told when, the victims were found and they were caught and they went back home, they literally went back. So when you were saying, I'm like, you know what? Yeah, that really does happen. Because I guess they felt as though that was, through the trauma bond that you're sharing with, they felt safe, even though they were in a bad situation.
Yeah, they knew what to expect.
Yeah.
So there was a predictability, even if it was violent, right? We now statistically, based on the information that we received from the victims we work with, our victims are having sex with at least 10 to 20 guys a day, right? Every single day. And most trafficking victims have a life expectancy of about 7 years once they start, due to just poor health outcomes, right? Disease, not having proper nutrition, violence, all of these things. So yeah, the average life expectancy is around 7 years. Pennsylvania rates about 9th in the nation as the highest trafficking. Yeah. I believe that, California and New York and some of those right on the West Coast have higher rates of trafficking. And then along the eastern New York, New Jersey type of thing. And then, Pennsylvania.
So how long is this list? 9th out of what? The 52?
Out of 50 states, yeah.
Oh, my goodness.
Yeah, so we're 9th. And those are like what's being reported into the National Human Trafficking hotline. And we know that not everything gets reported. So we know it's going on out there more often than we realize. The definition of human trafficking is force, fraud, or coercion. We do both sex trafficking and labor traffic. There's a lot more sex traffic than labor traffic, but our grid does cover both. And labor trafficking we see with more like immigrant populations, farming individuals who are moving to
that's what it's labeled, is labor trafficking. So people literally coming from other countries coming here to work.
Yeah, often that's probably one of the more common scenarios that you would see with labor trafficking, and it can be both. So in recently, one of the news stories was the massage parlors, and when they did do a raid on several of those massage parlors. There were 3 victims who came to stay at the YW, and they were.
This is around here.
Yep.
Wow. Recently?
Yeah, it was a few months ago.
Really?
Yeah, it took place in Cumberland County. And then they didn't have a place, like a secure location for all the victims while they were trying to sort out the details. And so 3 of the victims came to live at the YW, and they were all foreign nationals from China. So we do see, not just domestic, like domestic, natural born citizens, but also foreign nationals as well. And sometimes, it can cross over between, if it is a business, like a massage parlor or nail salon, it could be labor, but it could also be sex, right? So it's kind of like, what's the situation called for? What does the client want?
Right.
And unfortunately, as long as people are willing to pay for it, it just stays in business.
Wow.
It is a growing business, organized crime, because we often associate organized crime with drug trafficking, right? Where we have drug trafficking, there's a product that needs to be sold, and then you got to replenish that product. Where if you are selling a human being, you don't have to replenish that human being. You can use it over and over and over and over again.
Right.
So it's a lot more lucrative to do human trafficking for a lot of these organized crimes. Like, I think, they still have drug crime, but then now coupled with that is the trafficking, because it is so lucrative, because unfortunately we can pick up our phone and order a human being.
That's so sad. So what are the signs? Like, how can someone like myself see someone just walking on the street and think, other than gut feeling, because I think I have really good intuition, but however, it's just like someone walking by and they're going through it. Like, how can you tell?
Yeah, and it's really hard. And sometimes, what you can do in those situations, you can call the national hotline to report something that you suspect. But I know, homelessness is kind of increased since the pandemic. I see in Harrisburg, Pennsylvania, a lot more individuals on the street.
Yeah.
Right. And we have certainly reached out to them to see if they want services. And many of them don't. Many of them have drug and mental health, and have chosen to not, deal with those situations and stay on the street. But often if you see a woman with a sign asking for money, if you just kind of cast your vision around just far enough, you're going to see somebody else also with them, usually another man.
Oh.
And that doesn't necessarily mean they're being trafficked. But you can also tell if you go into, let's say, a place of business and it looks like they're actually living there. They're never left alone. When we first started doing trafficking work, and we work very closely with hospital systems, because most often victims present themselves at hospitals or law enforcement is somehow involved. And one of the nurses, like, didn't know what she was seeing.
Yeah.
She's like, it didn't seem right, but I didn't know what it was. And there was a guy, and he brought in these two young women and wanted to, like, get them checked out. And he was unwilling to leave them at any time. And so what we,
that don't leave them alone because they may say what's going on,
that they need help. And, that nurse was like, I wish I would have kind of recognized. She's like, something didn't feel right, but I didn't know what. And so we encourage, like, medical professionals to just say they need to go for an x-ray in a location you can't, even if it's not the truth, just to get them out of harm's way. But it doesn't always work, because I was just recently in the emergency room with my partner, and the nurse was doing an intake. He's having a gallbladder issue, poor guy. Aww. And she had asked if he was safe at home.
Oh, really?
And right in front of me. And I'm like, well, if you're really doing this if there really is somebody who's experienced victimization, and you're asking the question in front of the perpetrator, you're probably not going to get an honest answer.
At all.
No.
And the one that says yes is probably not serious.
Yeah.
Just sad.
Yeah. So I was like, well, I guess it's sort of working, but maybe you gotta, be better about getting them isolated and in private.
Right.
So.
Right. Wow. Yeah. So Central PA, did I hear somewhere where it's like the hub of the sex trafficking? And that's the most, like, mind-blowing thing for me, that we're living in an area where it seems like it's like a large population of activities such as this going on in our area.
Yeah. So our grant covers all the way from the New York border to the Maryland border. So we're along the whole 11 to 15 corridor and a couple other locations, and we contract out with a couple other providers to help us cover those areas, because obviously we're right here. But because 83, 81, 283, because they all kind of cross through, like, if you're going from New York, and you're going to cross through this area, right, on your way to DC or down south, and as victims are moved, they're going to cross through this area pretty frequently. So it is, I think in the last 10 years, we've been doing this work. Since we received our federal grant, we've had about 500 victims. And so, and that's kind of like central Pennsylvania, and those are the ones that we know about.
Right.
And it's only recent, it's in the last, I think, 20 years even, that human trafficking is a crime.
Wait, did you say the last how many years?
Like 20. Yeah, it
hasn't
hasn't been
the last 20 years that's been seen as a crime.
Yeah. Because there wasn't, like, a definition around it, and often it was viewed as prostitution. And we know that even prostitution has come a long way, where it was always the woman the prostitute who got arrested, right? It was never the person paying for the service.
Right.
Or the man, usually there's, kind of like,
their pimp.
Their pimp, yeah. Controlling them.
Right.
It's like they got off the hook, right? Yeah. There wasn't kind of a law on the books defining human trafficking until fairly recently. So they knew it was wrong, right? And there were some other laws in place that could get somebody arrested for such things, but it really wasn't as clearly defined as it is now, because we see it, and they're able to better kind of say, this is not, while this person looks like they're willingly participating, they're only willingly participating because they're getting something
in exchange. Yeah, like shelter, food, clothing, all the above. Man, so how can we as a community help the YWCA and their mission?
So, I think just awareness. Again, these are really hard conversations. Obviously, we're not nonprofit.
Yeah, this was heavy. This was heavy.
We're always willing. Our greatest need is always financial support. But in lieu of that, I think even in the decade that I've worked for the YW, I've seen a different mindset of people willing to have hard conversations. There are videos everywhere, right? Of people and their bad behaviors. And I know one of the things that really highlighted domestic violence was a football player who was caught on camera, beating his wife.
Oh, yeah, Dallas Cowboy.
Yeah. Mm-hmm. And it really, kind of elevated that conversation. Mm-hmm. And we've also seen a lot of sexual assault. Bill Cosby, everybody loved Bill Cosby, would have never thought, he would do something like this. There was just a follow-up news story on Matt Lauer, how all these men in power were basically, perpetrating on women. And there was a pattern of behavior. Mm-hmm. And women never wanted to come forward.
Yeah.
Yeah. And even people, like famous women who were perpetrated by Harvey Weinstein.
Yeah.
They were either too embarrassed to come forward because often the victim was blamed based on, a willingness or what they were wearing or how they behaved or something like that was the victim's fault. And I've seen that conversation change where more women are being believed. And I think the same is true for human trafficking and all of these issues that are being elevated, I think help us indirectly because we are able to do this work. We get more people wanting to have this conversation just like we are. We get invited into businesses and these are heavy conversations. These are not like lighthearted
at all. I need more. Yes.
It's I think that's how people can help. I mean, you can certainly, just as the New York City subway model was see something, say something, right? Having that awareness of what's going on around you and when something doesn't quite seem right, it's not your responsibility to investigate anything, but you can call and report it and say what you've seen and law enforcement can, take it from there.
Yeah. Thank you so much.
You're welcome.
For sitting down with me and having this sensitive topic or conversation.